We unanimously passed mental health reform, which built on the changes we began in 2013, and we're seeing results. In a recent report, Mental Health America declared that Iowa's overall mental health system is the 7th best in the nation, and 3rd when it comes to the adult system. And that's before the legislation from last year has been fully implemented. This year, the mental health regions are continuing to develop new services. And to help sustain them, I've set aside an additional $11 million in my 2-year Medicaid budget. I'm also calling on the legislature to extend the time the regions have to spend down their capital balances and to increase the percent of their operating budgets that may be carried over from one year to the next. But there is more to do. I'm asking everyone in this chamber to work with me to ensure that we have sustainable funding that keeps our mental health system strong. Another essential piece of a strong mental health system is having adequate behavioral health providers. To build on the existing and successful psychiatric residency program, my budget also proposes to fund 4 additional psychiatric residencies at the University of Iowa for doctors who will practice in rural Iowa. I've also asked for new funding to train nurse practitioners and physician assistants on mental health, also through the University of Iowa. Our efforts aren't over yet, but by working together, we will have the best adult mental health system in the country. When it comes to our children and their changing mental health needs, we're not as far along. That's not for a lack of talking and working on it. We've been doing that for more than 20 years. It's time to move past the talking phase.